My name's Dorothy, and I'm a Maryville student. I'm going to go ahead and do a patient assessment. The first thing is I'm wondering what your medical history, surgical history entitles.
Medical history would just be Hashimoto's disease, my thyroid, and then surgery. I had tonsils out, sinus surgery, nasal reconstruction all at one time.
Wow, that's a lot at
Yeah,
one time.
that's a lot.
Any smoking, drinking?
No
any
smoking,
drugs?
drink occasionally, maybe once a month, and no drugs.
All right. Any family history of any heart problems? Any thyroid family history?
My dad and paternal grandmother had Hashimoto's also.
Okay. In general appearance, you look very kempt, very clean, symmetry. Can you tell me your name
It's Kim Campbell.
and what we're doing?
Assessment, medical assessment.
And the date today?
Today is August 23rd, Sunday,
Excellent.
2015.
So I just did an alert oriented status, and your general appearance looks healthy. Do you have any pain right now? Any pain from 0 to 10? So when I do an
0.
assessment, you won't have any problems with that at all. Excellent. So the first thing I'm going to do is start with your head. So I'm going to go ahead and look any lesions, any bumps, any bruises, any tenderness in the back of the spine.
Nope.
Nope. I'm going to look at her hair, make sure it's symmetric, that it's well distributed. Same with that, eyebrows and eyelashes. I'm going to go ahead and look and feel the temporal pulses and make sure that they're elasticity, they're not pounding. Any tenderness there? I'm going to check the mastoid process. I'm going to look at the ears and see if I see anything. I'm pulling the ears. If it causes any pain.
Nope.
Okay, I'm going to go ahead and check on your frontal sinuses and the lower sinuses. Any problems with that at all?
Nope.
Okay, and right up here, I'm going to go ahead and check the back lymph nodes, the preocular, and the ones down the throat. And it should not be able to feel any of those. So looking at you, you look symmetrical. I don't see anything. Your skin looks good. So I like to look at your eyes. First thing is I'm going to have you watch my finger, and we're going to check your eye. I'm going to have it watch the direction it goes. Okay, and then follow my finger in. So you have good field of vision. And the next thing is I want to check, make sure your eyes are equal approach reactive light. So I'm going to look. They are reactive and they have good accommodation. Next I'm going to look and see if I can see the reflection. And there is nice reflection from the side. I'm going to look in the conjunctiva, and see if there's any pink there. They should be pink. And the next thing is I want to look and see your nose if there's any pain or any soreness. Can you hold your nose on one side and breathe through? And then the other side. All right, and then we're going to check some cranial nerves. So I'm going to have you close your eyes and tell me where I'm touching.
Forehead, right cheek, left cheek, check.
And that's cranial 5. I'm going to go ahead and check cranial nerve number 8. And I'm going to have you smile a little bit. Have your cheeks up for me. Close your eyes really, really tight. Okay, and then show your teeth. Excellent. The next test is I'm going to do a whisper test. So go ahead and close your ear to the other side. I'm going to say something. And repeat it for me.
Cat, dog.
And over here, do the same thing.
Mouse, rabbit.
The next thing we're going to check is in your mouth. So we want to look and make sure the skin, there's no cracks, lesions, any sores. We're going to open your mouth. We're going to look inside, make sure all the teeth are good. Have your lift up your tongue, look for any sores or lesions underneath there. Next thing we would do is we would take the tongue depressor, which I have. And then we would take the tongue depressor, we would put it in, and then she would open her mouth, and then we'd check for gag reflex. And then make sure your uvula is midline. Also, when we can check inside our nose, and what we're doing, when we do check up her nose, we're going to check to see if there's any deviations in the nose or any polyps. The next step I'd like to do is just do an overall look at the skin, make sure it looks good. And then we're going to check the skin on the arms. And then we'll check pulses. So we're going to go ahead and check the carotid. I'd like to check the brachial. We'll check the radial and check them symmetry, make sure they're good, and then we'll do the ulnar. Check the brachial over here, and then we'll come back to the neck and do the carotid. When I'm also looking at the neck, I want to make sure it's nice and straight. We'll check the midline of the trachea, make sure the JVDs are flat, the jugular vein distension. I'm going to check her thyroid if I have you swallow, and I shouldn't be able to feel the thyroid. The next thing I'd like to do is check heart tones. So the first thing I want to do is I'm going to listen to the aortic, which is second intercostal space. So we would listen here, which would be your S1. The second one we'll listen to is the pulmonic, which would be your S3. The next one would be Erb's point, which would be right here. Mitral, which sometimes you may not be able to hear, it'd be down lower. And the PMI, or the apex of the heart. So also can put your hand on there and you can feel if there's any palpitations. Next thing I'd like to do is check for fremitus. So you come to the back and you have her say 99.
99,
And go in.
99,
And I'm feeling for any vibrations.
99.
And listen to some lung sounds to the back. And listen to the upper. Deep breath. Deep breath. Deep breath. Deep breath. Just breathe normal. And then we'll come down to the front and then check for lung sounds as well. Just breathe normal. The next test you can do is you can put your hands to the back and have her take a deep breath in, and one checks symmetrical chest rise and fall, and make sure she's getting a good deep breath. Also, what I can have you do is lean forward, and then you're going to check the curvature of the spine and make sure there's no spinal curves. All right. Next thing I want you to do is put your hands out and see if I can push them down. Let me push them down. Okay. Push up. Okay, and then push down. Alright, and I'm checking strength. I'm going to check capillary refill, should be less than 2 seconds. Alright, with legs, I can check the back of the knees for the popliteals. I'm going to come down. I'm going to check the legs for any bruises, check the patellas. I'm going to check reflexes on both legs. You're going to check the dorsalis pedis and the tibia, dorsalis pedis and the posterior tibialis on both legs. Ankles, and then you're going to check capillary refill. Alright, you can go ahead and lay down for me. We're going to check the abdomen. Your stomach will be exposed. So the first thing I'm going to do is expect. I'm going to look for any bruises, any tenderness, any hernias. I would look to make sure it's if it's flat or concave. So the next thing I want to do is I want to listen to 4 quadrants. I'm going to check the right and listen for vowel sounds. Then the right upper, and the left lower. And I would hear vowel sounds. I don't want to hear any gurgling. I want to hear them not too fast and not too slow, so we don't hyper or lower. The next thing I'm going to do is I'm going to do percussions, and it should be tympanic here. It should be solid. I should have a solid for the spleen, and it should be tympanic over here. I can also palpate over the bladder, and it should be tympanic unless there's a full bladder, and it will be dull. I can come up and feel from the bottom and come up, and I have you take a deep breath and then blow it out. And that way I would feel the liver. And then I come over here, and I want to do the same thing. Take a deep breath and go in, and I should not be able to feel the organs at all. I would make sure that there's no pain in your hips, no pain, and I would check a femoral. Any pain in your abdomen at all? Any bowel problems? Any urination problems, frequency? No? All right, so you can go ahead and sit back up for me. And what I'd like you to do is go ahead and stand up. And if you could walk to the door and back. Here's that she's got really good gait. Good looking gait. Well, it seems to me that your assessment looks unremarkable. I don't see anything specific right now. Do you have any questions for me?
No.
All right. And then you said you had no allergies to medications, or you said no, you do have allergies. You have codeine and compazine. All right. Okay, and that completes my assessment.